Welcome to Health Watch, presented by Novant Health. I'm your host, June Baker. Our show features local physicians and health professionals discussing health topics of importance to local residents. Today, we will meet Dr. Michael Peters, a new physician with Coastal Carolina Ear, Nose, and Throat. We'll also speak with Katie Swain, who is a new nurse practitioner at Novant Health, Oceanside Family Medicine and Convenient Care. Our final guest is Cheryl Syracuse with the North Carolina Cooperative Extension, and she'll talk to us about food safety. So stay tuned to learn about valuable health topics with Health Watch. Our first guest today is Dr. Michael Peters with Coastal Carolina Ear, Nose, and Throat. Dr. Peters, thanks for joining us today.
Well, thanks for having me.
It's a pleasure to have you here. Now, I know that you're with Coastal Carolina ENT, and how long have you been with them?
I've been with them for 2 months now, a little over 2 months.
Little over 2 months. But I think you were here once before, is that correct? You were in the area and then you went off to do something else?
I was in Little River, North Myrtle Beach area in solo practice for 6 years. I left for a couple years for some family reasons, and we had such a good life down here, we decided to come back and live here again and resume my practice with Coastal Carolina ENT.
That's a great practice. I know of it personally, and I think they do a great job. So let's talk a little bit about you. Introduce yourself to the community and tell us a little bit about your education, your background.
Okay. Well, I finished my bachelor's degree when I was in the service, and as soon as I was discharged, I started medical school, and I did medical school in Brooklyn, SUNY downstate in Brooklyn.
Great
so I
school.
often say I went from one war zone to another. So while I was there, I was able to do a visiting rotation at the University of Minnesota in otolaryngology head and neck surgery, and was lucky enough to get into that residency program. So I did my residency there. And after my residency, I decided, well, I didn't decide, they chose me to stay there for my facial plastic and reconstructive surgery fellowship. So I was really fortunate to get into that program there.
Wow, quite a background. That's a very impressive educational background.
Thank you.
So now I heard you say you were in the service, you were in the Navy, is that correct?
Yes.
And how was that for you? Did you enjoy the service? And
It straightened me out.
well, that's one way of putting it.
It was good. I was a hospital corpsman, which is the Navy and Marines form of a medic.
Okay.
And I served on both coasts, and both with the Navy and the Marines, and was honored to serve with the 1st Marines and Fleet Hospital 5 with the ground troops over in the First Gulf War. So it served me well. I probably would have stayed in, but after the Gulf War and having family, I felt I should probably get out and do what I wanted to do. So I miss it to some degree. But.
Wow, that's real interesting. I was happy to learn more about your naval career. So let's talk a little bit about your practice. Where are you located?
Well, my primary location, actually the location I only see patients now, is in Little River, just over the border into South Carolina. We have other offices in Charlotte and an office in Whiteville where my partners go.
And do you have privileges at one of the local hospitals?
I do all of my inpatient procedures at Brunswick Novant Hospital. And I'll do some other outpatient procedures for locals down in a surgery center in South Carolina, but I probably do half of my procedures at Novant Brunswick.
Great. We're really pleased to have you here in the area. I think you bring a wealth of experience to this area.
Well, thanks. I've been impressed with the hospital and the operating rooms, and I'm looking forward to bringing more cases there, actually.
Great. Well, now we've had Dr. Corey on the show in the past from Coastal Carolina ENT, but I think you have a couple of other partners, and do you want to share those with us?
Sure. Dr. Kenyon, he's the partner who started the practice years ago, and Dr. DeMuzio. They're the other two that cover the two offices in North Carolina.
That practice has grown. It's up to 4 physicians now, so it's really grown a lot. Some folks are not familiar with what an ENT doctor does or is, so do you want to talk a little bit about that for our viewers?
Sure, it's the most difficult specialty to pronounce. Otolaryngology, head and neck surgery is the formal terminology, but basically we treat diseases of the ears, the nose, the throat, pretty much everything above the neck, not including the brain, the spine, and the eyeballs themselves. And it's a pretty broad spectrum set of disorders we treat. It can be anything from as simple as giving medications to doing surgery with microscopes and removing cancer and reconstruction and trauma. So it's a fairly extensive field of diseases that we treat.
Now, I know you did a fellowship in plastic surgery.
In facial plastic and reconstructive surgery.
Let's talk a little bit about that.
Sure.
What kinds of procedures might that entail?
Okay, well, the training initially was pretty well broad spectrum facial reconstructive.
Would that be like after
treatment.
An accident?
It was
like
after an accident, trauma, skin cancer reconstruction, head and neck cancer reconstruction, cleft lip, cleft palate repair in children, trauma, cosmetic surgery.
So you do cosmetic surgery?
I do, yes. And that's probably about 30% of the reconstructive work I do. Most of the reconstructive work for medical problems or for diseases usually requires that we remove something bad, and then we want to fix things so that they work well and look good. So that kind of feeds into the cosmetic part as well. So I like doing the cosmetic part. It helps keep my skills up for the reconstructive part, but the reconstructive aspect for diseases is more rewarding.
I'm sure. Especially, I know you see children, is that correct?
I do.
And you do cleft and palate reconstruction?
It's a little bit harder to do now in the private sector. You really need a more concentrated team.
I see.
I'll do some revisions and treat some secondary cleft palate and cleft lip work, but I've left that work to the larger universities where the children can be taken care of with a more comprehensive team.
Now, the procedures that you were speaking about, are those mostly inpatient or outpatient procedures?
Outpatient. The majority of the skin cancer work I do can be done right in my office.
Oh, that's great.
It saves time. Saves
What's
money.
Cost saving.
Cost savings. For people who aren't comfortable doing it in the office, we can do it in the hospital or outpatient.
They don't want to know what's going on.
Exactly. So rarely, if ever, does anybody have to spend more than a night in the hospital. But I'd say better than 95% of the patients are going home the same day.
Is there a common procedure that you do most often? I'm just curious. What do you do the most of?
As far as reconstructive work, the 3 probably most common reconstructive procedures are skin cancer removal and repair. The second is nasal reconstruction. And the
like
third,
I had a broken nose, and I have this deviated septum thing. Like I can't breathe out here, and you could fix something like that.
Right, that part, or even more complicated things where people have been operated on before and they need revision work. So that tends to be my area of specialization, nasal reconstructive work. And then thirdly, eyelid reconstruction for vision, for the upper eyelids if the eyelids are drooping, or for the lower eyelids if they're drooping and they cause infections and irritation of the eye and the eyeball. So those are the 3 most common areas that I treat.
And then in terms of cosmetic surgery, what would be your most common?
Probably rhinoplasty, the nasal reconstruction, or nose job.
Nice job.
And,
I was thinking it was going to be eyeballs,
Oh,
eyelids.
eyelids are right there with it. I've probably done as many as both, as many eyelid reconstructions as nasal reconstructions. And then I'm very selective in the facelift skin tightening procedures. Those are big procedures, and I like people to get good results, excellent results. So I'm very selective in when and if I'll do those.
So are you currently accepting new patients?
Always.
Good. And how might we contact you if we'd like to schedule an appointment? Do you need a referral or anything like that?
No referrals are necessary. Referrals are typically needed only if the insurance companies require that a patient needs a referral. Either the patient's family doctor can call and schedule with us, or they can call directly, or any of our offices. But for me directly, we have a phone number for our office in South Carolina.
I'm so glad you were here today and let us get to know you a little better and let our viewers get to know you. So I hope you'll come back and visit us again sometime, and we'll talk about something different.
Well, it's been a pleasure, my pleasure.
Well, thank you again.
Thank you.
Our second guest is Katie Swain, nurse practitioner at Novant Health, Oceanside Family Medicine and Convenient Care. Well, welcome to the show, Katie. I'm so excited to have you here.
Thank you.
Good. Now, usually I ask what brought you to Brunswick County, but I know that you grew up here.
I did.
So to talk to us a little bit about your education and your background and how you left Brunswick County and where you ended up.
Okay, sure. So I did grow up here. I went to UNCW for my undergraduate and did nursing. I did that, moved away, worked in Charleston for a little while, decided to go back to graduate school. So went back to Duke for my graduate program and wound up back here with my family. My fiance and I wanted to be closer to our family, so here we are.
So now you're a nurse practitioner.
Yes.
And you are here locally with your family and in a new practice,
Yes,
right?
that's right.
Well, good. Well, I believe you're at Novant Health, Oceanside Family Medicine and Convenient Care.
That's right.
And what is your role there, Katie?
I'm a family nurse practitioner, so I work in the convenient care and the family practice. So I take patients of my own and I see walk-ins in our convenient care.
And let's talk about that convenient care a little bit.
Sure.
Now, I know they have extended hours, I believe, other than what the practice has.
That's right.
So let's talk a little bit about the availability of appointments and things
Sure.
like that. And can you just walk in? And
You can. We are open. The convenient care is open 7 days a week.
7 days a week.
That's right. Monday through Friday, we're open from 8 to 8, and on Saturday, 9 to 6, Sunday, noon to 5.
Noon to 5.
So, and that's walk-in hours. You walk in and you see whatever practitioner is able to see you at that time.
Can you make an appointment in convenient care, or is it totally walk-in?
You can. In fact, a lot of people do that. They'll call and see, the earliest they can get in, and we like to get you scheduled so you don't have to come to the office and wait.
Great. And then you said that you do take patients of your own. So if I wanted to call, or one of our viewers wanted an appointment with you, they would just call the main number and schedule with you.
That's right.
During a time that you're working.
Yeah.
Great. Well, I know that you're a nurse practitioner, and we've talked about that a good bit in the past, but very simply, what is the difference between a nurse and a nurse practitioner?
A nurse practitioner has gone back and gotten, some people go back for, their PhD, for their doctorate, and I've gone back for a master's. So, you have the advanced education. It's an
Right.
advanced practice nurse who, we lots of times are referred to as mid-levels. We work in collaboration with physicians in providing patients the best care they can get.
Can you write prescriptions?
Yes, we can.
Well, that's very good. I think sometimes physicians need that extra hand, and so it's a great supplement to their
Yes.
practices. So what where is the practice located? I think it's relatively new building.
It is. It's a really nice building. It's located off of Cellar Street in Charlotte, which is near the Food Line and the DMV. And
Everybody knows where the DMV is.
that's right. So we're right there. It's on a back road. I think it's 5145 Sellers Street, and right near the DMV, so it shouldn't be too hard to find.
It's a very nice building.
It is.
It's really a nice area, and there's plenty of parking. It's a huge parking lot.
Yeah, and believe it or not, we're really actually outgrowing it. So
I've heard Dr. Eisenhower say that. Let's talk about a little bit about the other providers that are there. I know it's Dr. Eisenhower's practice, and he has 3 other physicians in the practice.
That's correct. So there's Dr. Eisenhower, who has a very busy practice.
Yes, he does.
And then there's Dr. Pritz, Clark Pritz, and Dr. Angela Thompson. And then there is Tiffany Lewis, PA, Marie Wheatley, nurse practitioner, and myself. And then there's Bonnie Hood and John Fillmore, nurse practitioner, who they work mostly in the convenient care.
I see. Well, that is a big practice.
It is. We're growing by leaps and bounds, so we have a lot to offer.
And speaking of having a lot to offer, what all kind of services do you offer there?
We have a lot. We have a full lab service. We have X-ray. We have ultrasound, and we have a bone density scanner. So,
oh wow!
Yeah, we have a lot to offer right there in our office.
So, do you do women's health?
We do. We do, and we have a lot of options to choose from as far as different providers and
Yeah, you have male and female, and it would be a one-stop shop for women.
Definitely.
Yeah. Now, we've talked about all the nurse practitioners there and the PAs and the physicians. And all of you have a certain interests, I'm sure. And do you have a favorite?
I think right now what I enjoy focusing on is preventative care, getting people in and trying to keep them healthy versus, working the backwards way and they're sick and trying to back up. And sometimes, we have to go that route, but I like to try and focus on keeping people healthy.
Now, you did say you're currently accepting new patients.
Yes.
And could you give us the phone number at the practice?
It's 910-754-4441. So it's a pretty easy phone number to remember.
It is, 4441. And so any of our viewers out there who would like to make an appointment can just call the main number and ask to schedule an appointment with you.
Yes.
And then they would be seen in one area or the other, depending on where the room is, right?
That's right, yep.
Well, thanks again for being on the show today.
Thank you for
having me. It's been a pleasure having you, a pleasure getting to know you, and welcome back to Brunswick County.
Thank you so much.
You're welcome. Our final guest today is Cheryl Syracuse with the North Carolina Cooperative Extension. Well, welcome back to the show, Cheryl. I am so excited that you're here.
It's good to be here, June, and Happy New Year to you.
Well, thank you. Happy New Year to you. I know the last time you were here, I had a blast. That was so much fun. So I'm really excited about today. But for the folks who didn't see us last time you were here, let's remind them who you are and what you do.
Okay. My name's Cheryl Jones Syracuse, and I'm with the North Carolina Cooperative Extension. I primarily teach nutrition, food safety, and I also do a little bit of education for restaurant employees related to food safety.
Oh.
I've been working for the Cooperative Extension Service for over 35 years, of the last 7 of them here in Brunswick County.
Well, good. We're glad to have you. Well, it is the beginning of a new year, and so I thought maybe we would talk a little bit about resolutions, but in terms of food safety and things like that. So I think you might have some tips for me or some questions. I think we're going to have a...
We'll get to some questions, but first off, I brought a couple of things that I'm thinking every house needs to have.
Oh, good. Okay.
If these houses have these 3 items,
okay,
they really can combat food safety issues. And what we're talking about here is foodborne illness primarily. Some people call it food poisoning, but the correct technical term is foodborne illness.
Foodborne illness.
Right.
Okay.
But basically, when people get sick because of something they ate, something they drank, or or perhaps something that has happened in their home.
Oh, I see.
Okay, so 3 things that I think every house should have that would really help.
Okay.
And one of them is a thermometer.
I got that.
You got that? And this is an instant read thermometer. It's not a digital, but you can get digital. This is primarily for use in food. You pull food out of the oven and put this in, or in a pot of cooking food, something in the microwave. Another item, I don't know if you have one of these, but this hangs in your refrigerator.
I have one of those too.
Great. Got one in your freezer too?
No.
Okay. Well,
Okay.
maybe you need to buy 2.
Okay.
Okay. One for your freezer, one for your refrigerator. Well, and that's a key to want to keep the temperature at least below 40 in the refrigerator.
Okay.
And as cold as you can get it in the freezer. You can get it down to 0. Sometimes things are hard,
Yeah.
but they're not really at 0.
Oh.
So if you can keep it colder, it's even better.
Okay.
And then the other thing is just some simple bleach. And it doesn't have to be expensive.
Okay.
Sanitizer kinds of things. A regular chlorine bleach would work, but better bleach that is not necessarily the concentrated kind and not necessarily one that has a scent. Just regular old bleach. And you can use that for a lot of different purposes in sanitation in the home.
Just like cleaning surfaces and
Yes.
things like that?
You mix it with water. You don't
Okay.
want to use it straight out.
All right. And be careful your clothes because
Well,
you end
exactly.
up with blotches
I have a
all
little
over.
notice here. Don't mix it.
Oh, yeah.
Don't
Ooh.
mix it with ammonia.
Why? What happens?
Oh, it gives off a
Like
a
a toxic-
vapor.
Oh,
yeah,
really?
toxic vapor. Yeah, you wouldn't want to mix it with ammonia.
Okay.
You could change the ratio based on the kinds of things that you're cleaning up. You could read the label. The label most of the time has you how to disinfect, how to sanitize. The general ratio is 1 tablespoon per gallon of water. It's not one of those things that a little's good, a lot is more. No, you want to
I'm
watch
kinda
this
like that.
carefully. Yeah, you want to watch the amount that you're putting in there. And like you said, with your clothes, sometimes you put it on countertops and then you rub up against it and you have splots on your clothes.
Yeah.
You don't want that. So you need to be a little bit careful when using it. But just simple bleach is a good sanitizer.
Okay, good. Well, I have 2 out of 3, so that ain't bad.
You're good. Good.
Okay, so what are we going to do now?
Okay, I got a quiz for you.
Oh, I am so excited.
Okay. And we'll start off. Some of them are true, false. Some of
Okay.
them are yes or no. Just give us an idea what you think.
All right, I didn't study, so.
What do you think is the germiest place in the house? Now, you think it's a germiest? Do you think that's the right word?
I think that's a good word.
Okay,
Sounds
germiest.
good.
What's the
place.
germiest place in your house? Not necessarily your house, but anybody's house.
How about the bathroom?
Good answer, but wrong.
Wrong.
Wrong. Yeah, actually, there have been studies, and several universities have done studies where they actually send students in and they do little swabs and then try to grow them out the cultures, and they have found that the kitchen has more germs.
That was my
in
second
it.
guess.
Yeah, more germs in it than the
bathroom?
bathroom.
Oh, good
So, and that's where most families hang out. It's where your
Yeah.
food preparation is done. But people do worry about the bathroom. Okay, so think about, what do you think is the worst culprit in that kitchen?
I'm going to say a sponge.
Yeah, good one. Yeah, just a regular kitchen sponge or even the
Dish
dishcloth
rag.
that you're using. Yes. They stay moist a lot, great
Yeah, they
breeding ground for bacteria.
So what do you suggest in place of that?
Well, you could use a disposable kind of wipe.
Mm-hmm.
You could use paper towels, or just use a lot of precaution with these.
Oh, I see.
You know, if you're using a sponge, pitch it out every 2 weeks at least,
Mm-hmm.
if not sooner. If you're using a dishcloth, you can throw that in the wash quite frequently, even
Right.
every day. Get a new one.
Yeah.
One of the third places it's the germiest, besides the sponge and the rag, is actually the kitchen sink itself.
Really?
You check that drain in the sink, and they've done that little testy thing, and
Yeah.
and that's where the germs are multiplying and aggravating or growing. I got a way that you can solve all 3 of these issues at one time.
Okay, what's that?
When you're doing your dishes at night, cleaning up the kitchen, make yourself a nice sink full of warm water with some bleach solution. Put your sponge in it, put your rag in it, use that to wipe up the sink, then let that bleachy water drain through the drain.
Oh, well, that's simple enough.
It's very simple. You can actually, if you watch your proportions on bleach to water, also use that to wipe off the kitchen counter. Now, the other thing to think about there is then don't get kind of carried away and get your paper towel or your dish towel out and wipe it off. You need to let it air dry.
I see.
Give it some time for the sanitizer to work and, and to kill the bacteria.
Okay.
One more quick thing. Lots of people have heard, and they talk about it on the internet all the time, about putting sponges in the microwave. Have you heard that one?
No,
Don't do it. Good, you haven't heard it.
I haven't heard that.
Lots of people do it. I see people do it. I've even recommended it. But I recently read a study from the National Cleaning Institute. They take this moist sponge and you put it in the microwave and you turn it on. And it does get hot. And the concept is it's killing bacteria. But there's so many variables. How moist was it? How big's your sponge? Was it in there long enough? If it wasn't moist enough, it might catch your microwave on fire. You don't want to do those kind of things. This whole bleach thing and throwing the sponge away is the best bet.
Okay.
Okay?
All right.
All right, so we've got the germiest part done.
Okay.
Let's see if I've got, a couple other hot spots. And I've got one of them here, a couple of them here.
Oh, I love you. Always bring your toys.
Toys. Can openers, big hot
Yuck.
spots for bacteria. Can you throw your can opener in the dishwasher? All that blade, see if you can get it cleaned off. I mean, just think about it. You did the dog food and then you did the tuna fish and it's all kind of, So if they can come apart, throw it in the dishwasher. If not, when you get that little bleachy water out, do some scrubbing on it.
Okay. I bet you have the most sanitized kitchen
I
in the
try.
world.
My mom just, she goes, "Are you doing that again?" I go, "Yeah." Inside spatulas, they have found. If those can come apart, they breed bacteria. So if yours come apart, take it apart, put it in the dishwasher this way, or scrub it with some soapy water. Sometimes you can't get them apart, and that's good too. Okay, that's good too. Okay, how long do you think? Question 2.
Okay.
Food in your freezer. How long do you think it'll keep?
6 months.
Okay.
Is that good?
For some things, yes. Actually, there's a big, long chart on what keeps better. Now, and there's a lot of variables. Luckily, this past year, we didn't have lots of power outages because of hurricanes. So we didn't have to worry about power outages and food safety. But how long food has been kept in the freezer, a lot of it depends on, can you keep it cold enough using your thermometer there? The colder it is, the longer it's going to stay good quality. There's kind of a difference between, is it safe, and do you really want to eat it?
Yeah, I understand.
Yeah, this past Thanksgiving, people have called up and said, "I've got a turkey in my freezer, and it's been there since last Thanksgiving. Is it safe to eat?" I said, "Yeah, if the freezer's been cold, you haven't had major power outages, you know it hasn't thawed, that turkey's safe after a year."
Right.
But do you really want to serve it on the big holiday?
Yeah, really.
So quality does tend to go down based on how cold the freezer was and how long it's in there. So some things like that solid turkey, a solid roast that has never been cooked, we go with a year as a good number. Things that are leftover, like leftover soup, something that's totally been cooked, a month to 2 months is a good time frame.
Yeah, I never know about that.
Again, for quality. If it's frozen solid, you're good safety-wise. So leftovers, do them a little bit shorter time, but also then, it depends if you have what my grandma used to call a deep freeze.
Yes.
Versus just that thing on top of your refrigerator.
Yeah.
Okay, the ones on top of your refrigerator just don't keep things as cold. So things are going to get freezer burn, they're going to get dried out, the quality is going to be worse. So you need to use those sooner. But again, we're not talking safety.
Safety, yeah.
We're talking quality.
Well, I hate to tell you this, but our time is up.
Where does 10 minutes go?
I don't know, but will you come back?
I sure will.
And we'll save the rest of the questions
We
for
got
the
lots.
next quiz.
Sounds good.
You promise you'll come back?
I will.
Okay, great.
Okay.
Thanks again for coming. We're so pleased to have you.
It's great fun.
Okay.
Thanks.
Thank you for tuning in to ATMC TV's Health Watch. I hope this information was beneficial for you and your family. If you have any questions or topics that you would like to see discussed on a future show, please email them to atmctv@atmc.coop. Please visit NovantHealth.org for more information on Novant Health Brunswick Medical Center, local doctors, and general health information. Thanks again for joining us today. Be sure to join us next time for Health Watch on ATMC TV.